But
All right. Do you want to kick it off?
welcome to episode 3.
Welcome back.
Welcome back, episode 3. So yeah, today topic that is near and dear to one of your hosts' heart is a conversation about health insurance and all of that stuff.
Yeah, what's crazy about this thing is this is the first time as an adult, like living on my own, having my own insurance for the first time, where I've really had to deal with it, like in a astronomical level.
There's a solution for that. Just don't go to the doctor.
Right.
I'm kidding though.
But
the
seriously,
situation
go
you
to
were
the
dealing
doctor.
with was one that you couldn't,
Because
you
I'm
couldn't-
realizing
couldn't avoid
now,
that.
not just the doctor, but like, I'm 32, and I've, like many male models in my past, I have followed that like habit of just like once I was out of the house on my own, kind of neglected the whole medical thing, like the dentist, the eye doctor, going to the doctor for a checkup, all that kind of stuff. The only thing I have not neglected is the chiropractor, which is great, and
Yeah,
there's
there's definitely value.
and
there.
there's a huge plus to doing that, and then noting going through that and not having to go to the doctor as often,
Right.
or getting sick. But anyway,
Right.
the big thing is I have a job. I have some okay insurance through Blue Cross Blue Shield,
Which costs you X amount of dollars per pay.
yes, per pay,
Right.
which is another thing. It's just it's an all it's been 4 or 5 years, but that is something that I've had for the first time in my life on my own. And in the last year, I've gone to the dentist. I've gotten some work done, and you have your co-pays and your whatever amount that your insurance covers and all that. And but unfortunately, like doing all the basic checking up and getting all that stuff done, I unfortunately had to have a surgery a few months ago, and not only a scary experience just in that aspect of having that done, but also dealing with the financial side of it, which I'm just now dealing with.
Right. You just got the bill.
I got the
right?
bill, yeah.
And we don't need to talk about the number, but
No.
it's astronomical.
It's big enough.
And so it begs a question. And there's a lot of layers to this topic.
Yeah, there is. I have a lot to say.
There's a lot of layers to this topic. There's obviously the cost to the employee. Those of us who have employer provided health insurance, in most cases, we pay a portion of that cost, and the employer bears a higher amount of that cost per person,
Right.
which is a lot of money. So it begs the question of like, why does it cost a company so much money per person
Right.
to have insurance? It's crazy. And then you have you go to have a procedure done like you did. You got a copay, right? Not to mention you had a couple of visits to like ER or
Well, yeah. So
urgent
even
care, right?
before all that, I
So-
had an emergency room visit to find out what was even wrong.
Right. So there's a charge for that.
IVs, CAT scans, X-rays,
Yeah.
all that stuff.
Yep.
And already had to pay some of that out of pocket,
Right.
because
Yeah,
copay
exactly.
and all that.
That's
And then finding out that I had to go schedule and get set up with a surgeon.
Right.
Like that
a
was
specialist.
yeah, a specialist. So yeah, I mean, from the get-go, it was already like,
Yeah.
wow.
Exactly. So now the bill comes a month later, and you're like, oh, okay. Yeah. So you have the cost itself that the insurance company charges an employer, and I have some familiarity with how that process works, and it's a little bit, it's kind of crazy because we have HIPAA laws, right?
Right.
That are supposed to protect your privacy.
Yeah.
But in my experience, the insurance company does look at your employees' experience
Yeah.
the prior year in terms of, oh, hey, Fred over here, this guy's got emphysema. He's gone to the hospital 16 times this year. And Mary over here, she's on the heart transplant list.
And that's how they measure how much money they're going to make
Right.
off
So
you.
they go, well, Mary's going to cost you X. Fred, not as bad as Mary, but still cost you a lot.
Right.
And then they take that and lump it all together, divide it up by the number of employees, and say, okay, it's going to, okay, here's your total cost, and it's going to cost X per person, blah blah blah. And then the employer says, okay, well, we'll pay 2/3, half, whatever that number is, and then the employee's responsible for the rest.
Right.
That's even before you go to the doctor.
Yeah, and that's another thing that I've been learning a lot about this whole thing lately is like even what the doctors go through.
Oh,
Like,
yeah.
Because the
Yeah.
doctors, at the end of the day, they are scientists and people that work on the human body. Like that is their profession. But unfortunately, a lot of the doctors, and especially the ones that care enough, they have to all of a sudden teach themselves to be like a business person and a lawyer and all these things
Yeah.
so that they can do their best to get their patient the best care that they can. But the problem is the doctor deals with the insurance company and then they're questioning the physician on, well, why do they need this and what is this and did you do a CAT scan for this?
Right.
And it's like the doctor has to like fight for the patient at that point.
And the trend that we're seeing as far as the doctors are concerned is that fewer and fewer doctors are in private practice
Yeah, I was going to bring that
because
up.
there are these corporations that own the hospitals. So if you want, as a doctor, if you want your and I spent some time working at a hospital in my career. If you want your privileges to, let's say you're a gastroenterologist, for example. If you're going to perform surgeries at our hospital, you have to have privileges. You have to be vetted and all that stuff to
Right.
be given privileges to utilize it. Well, now what they're doing is they're saying, you're essentially an employee of ours, and we control the methodology or method of care for patients, not
Yeah.
you as the doctor
Right,
anymore.
yeah.
Right?
Yeah. And I feel like the biggest thing is about insurance companies is like you do not like any private information, like you brought up HIPAA, you don't want insurance companies knowing
Absolutely
about
not.
what's you don't want
No.
them digging through your underwear drawer basically.
No, and because what will happen is we've all done it, right? We go to the doctor and it's like, fill out this form, right? How often do you drink? Do you smoke? Do you use tobacco? Do you do
Right.
this? Do you do this? Blah, blah, all these questions, right?
There's a whole checklist for them to break down.
That all goes back to the insurance company in some way, shape, or form. They start looking at this person is a problem.
Right.
This guy drinks 7 days a week, smokes 3 packs a day, is 50 pounds overweight.
Yeah.
Oh, he's also 56 years old.
Has
so
a physically demanding job.
physically demanding job. So he's like prime slot for us.
And
to
he's
just
like at a job 3 to 5 years
Yeah.
tops.
So they go, yeah,
That's your target right
that's
there.
a target right there. Yeah. So it's like, but it's it's hard to get around having to do all of that stuff. Like you said, digging through the underwear drawer. Every doctor we go to, everywhere you go. Like I had to get a drug screen last year, drug test, just a urine test, and I had to answer all those stupid questions.
Yeah,
Or they're
it's-
not going to let me
Yeah.
put my pee in a cup.
And I think that's another reason I'm seeing a lot of private practice are starting to not accept insurance
Yeah, because and we can. This is
because
probably
they can make more money that way.
this is probably going to end up being more than a single episode because
Yeah,
this is like I
probably.
said. There's a lot of layers to this. There's
Yeah.
you have the insurance company, you have the corporations that are now owning multiple hospitals. Then
Right.
you have the doctor
And pharmacies.
the doctor piece. Well, and then there's the pharmacy
Yeah.
piece. It gets sketchy,
It's
really sketchy. I wish I had my phone with me. Because
I know.
I watched a great episode that Sean Ryan had this guy on his podcast. And his name is escaping me.
I wonder what his name was. Was he bald?
Yeah,
Did Joe Rogan have him on too?
probably yes.
Okay, I think
Yes.
I know who you're talking about.
So he owns his own compound pharmacies and stuff like that.
Yeah, okay.
Okay, that guy.
I'm familiar with
I
him.
can't think of his name.
Yeah, I can't
It's-
either.
I can picture
literally
him.
just watched him yesterday.
And he's so his company, he has his own company too, like a biomedical company
Yeah.
that has worked with Aaron Rodgers and some people like that who are into more of the non-mainstream medical ways to take care of yourself.
Right.
More about nutrition,
Okay.
brain health, proper sleep, hydration, all that stuff, right? But this guy's stories on the pharmacy side of things is frightening.
Yeah.
And, it's frightening how the pharmaceutical companies, there's supposed to be this transparency, and it's not there. There's no transparency with the federal government when it comes to pharmaceuticals, the cost of pharmaceuticals as it relates to Medicare and Medicaid patients.
Yeah.
They tell the federal government it costs us $600 for this pill.
Yeah, and you know who's
Eh,
telling them that? It's the pharmacy benefit manager that they
Yes,
put in
the
place so
pharmacy
many years
benefit
ago.
managers are the ones that control that narrative. And the same thing is happening to us.
Yeah.
So his process is more of like you said, a cash-based system where because as a pharmacist, they're not allowed to tell you, oh, I could give you this, it's cheaper.
Right.
They can't do that.
No, they're not going to
The
do
only
that.
thing that they can offer you is a generic alternative to what you're taking
For
that would
whichever
be
pharmacy
cheaper.
you're at.
Correct. So his because if it goes through insurance, that's dictated by insurance as far as what you're going to get and what they can tell you. So his cash model allows him to say, I can do this. You pay me cash, a third of the cost of what your insurance company is going to charge you, and I can I can make it for you at my pharmacy way cheaper, and it's way better for you.
Yeah.
Go ahead. I can tell you're waiting. You got something
The
to say.
problem is, and these are the people that are, so they're choosing the type of pill or prescription or whatever. For example, say it's for like
Let's say it's for high
like
blood
insulin
pressure.
or something. Or, yeah,
Just
high
say it's
blood
for
pressure.
high blood pressure. I mean, there's
So
how many?
they are going to
hundreds
pick
of millions of people
the
on high blood
medication
pressure
that's going to
medication.
profit them the most money, not what's better for the patient. What's going to make them the most money on that one prescription? And like, for example, say you got a patient with a real thing, and like their thing costs $380 or something like that, and then I think it's the pharmacy or whoever. I think they charge they make like $40 off of that. That pharmacy benefit manager is making the profit off of that, and then the patient's still paying more for the medicine.
Right. Exactly.
How messed up is that?
And I think one of the at the root of a lot of this that to me is like so obvious is in this country anymore, we don't practice preventative medicine.
No.
I mean, the reality is we want the medical industry wants people on medication. Here's a question I have for you.
Yeah.
When it comes to when you think about a medication, let's just say, for example, you get a really bad cold, you got a fever, whatever. You go to the doctor, he gives you Z-Pak, right?
Okay.
5 days later, you feel better, right?
Right.
How come people take high blood pressure medication for 30 years?
And never get any better.
It never gets better. Why?
No, it's just like a controlled,
It's chronic illness that is propagated
just like pain.
by the industry. Pain management, same thing that happened there.
That's
And
probably one of the biggest issues.
And so instead of a doctor sitting down with you and saying, "Hey, Jordan, your blood pressure is slightly elevated. Your heart rate's pretty good. You could lose 10 pounds. Let's do this."
I've been told that.
Okay, but
those things.
But did he sit there and did he go through with you like, "Hey, we got a nutritionist on staff that'll help you"? No.
No.
He just said, "You need to lose 10 pounds and your blood pressure is a little high."
Right. Yeah.
And see you later.
Yeah, that was it.
Now, we all have access to the internet. We all can do our own research and figure out ways that we can eat healthier,
Lower our blood pressure.
lower our blood
lose
pressure,
weight.
ways to exercise without being a gym rat. There's tons of ways to do it, but we don't practice that.
No.
People go to the doctor with the hopes of getting better, and the problem is they don't get better. You get a medication that creates another problem. A year later, you go to the doctor, and now you're on 2 medications.
Yeah.
I think on in that podcast, that guy, God, I wish I could remember his
I
fucking
know.
name.
I'll remember it as soon as we're
He
done.
said, if I'm not mistaken, the average American is on 4 prescription medications.
That sounds right. That's crazy.
Think about that.
Yeah.
Just think about that for a second. And we're wondering who's pulling the strings here?
And here's the problem. This kind of goes in hand with our last episode too, because the problem is the majority of people in like an average class that make an okay amount of money, that have insurance, they are stuck at these jobs all week long, and they see what they are getting charged when they go through something like this. So people, one, don't give themselves the time to take care of themselves. And then when they do have to deal with something like this, that's why they're on all this medication.
Yeah.
Because
Right.
it's a revolving door of like, you work, you get sick, and then you got to go to the doctor, and then they help you feel better. Then it's a vicious circle.
You feel better for a year.
Yeah.
And then a year later, something else pops up. You go back. Blood pressure's okay, but now you got, I don't know, something else, whatever. I'm not a doctor, so I don't know. Think of something. And then, well, here's what we can do to help you with that, Joe, is give you this medication. And you're on that for 20 years, just like you've been on a blood pressure medication for 20 years.
Yeah.
And then before you know it, you're taking 4 prescription medications that are costing you, let's just say, for simple math, $100 a month, on top of whatever's coming out of your check every Friday when you get paid.
Right. Yeah, and another thing that's crazy about this is like, and especially with work or whatever, the insurance companies love to just kick the bucket around because no one really wants to be responsible for whatever's happening. So like, say you went to the like, say you're at the hospital and you hurt yourself at work, like you fell or something at work, and then the insurance is like, well, we're not going to cover this. That needs to go to workers' compensation.
Yep.
And then they get involved with them, and that's just like pushing the problem somewhere else. Or you got in a car accident and they're like, well, we're not going to cover that. You need to get with the auto insurance. And it's like nobody.
And then somebody dictates to you what doctor you have to go to at that
Right.
point. Especially if it goes to workers' comp, or if it goes to if your car insurance company gets involved.
Especially if they're dealing with your employer too.
And your employer's involved, they're going to tell you what doctor you have to go through this routine of whatever you have to do to get better to come back to work. And the reality of it is that the patient really has very little say. It's like, think, for example, if you needed let's say you needed a shoulder surgery because of your job, you mess up your shoulder. Go to the doctor. He's like, yeah, let's do an x-ray. Oh, you got a shoulder impingement problem, blah, blah, blah. I'm going to refer you because you can't go see the orthopedic doctor until you get referred by your primary doctor.
Right.
That's number one. So you go see this orthopedist, and he's like, what's he do? Another x-ray, an MRI. And then he goes, yeah, we can do surgery. And you go home and you're going on Google and you're saying, because it's your body. And I want to go to the best shoulder surgeon that I can within 50 miles of where I live.
Right.
And you find out that it's not the guy that you got referred to. It's a woman in Cleveland.
Yeah.
And guess what? Go to schedule that. We don't take that insurance.
Yeah. Or, hey, we can't take you until July.
Or July of next year.
Yeah.
We can get you on the books. Mm-hmm. So now you've got a year to deal with this before you can go get surgery. You're in pain. Then what happens? Well, we got something for that.
Oh yeah, we can deal with that.
We got this pain management process and a drug that you can take for the next year before you can have surgery.
Right. And then what happens then? Unfortunately, some people get addicted to pain medication,
Yes.
or and then other problems, liver problems at that point, or whatever else. I mean, it is a never-ending cycle.
It's like this hamster wheel of, and in the insurance company, like you said, kicking the can down the road, like they love to deny claims.
Mm-hmm. All the time.
You have insurance. You did what the doctor told you to do. You go get this procedure done or whatever. The claim goes through, and they deny it.
Yeah.
Like, what the hell is that all about?
And it's like, in a perfect world, say like Blue Cross Blue Shield's gonna we're gonna help you out. We're gonna streamline this whole insurance language so that we can give you the best of the best and whatever.
Bullshit.
And then they are in control of what gets covered, what kind of care you get, and they can pretty much decide when to kick you off too.
Yeah.
I mean, it is like you have absolutely no say in all of it. And then at the end of the day, you're the only one being punished and dealing with the problem and losing money.
Yeah. So it's such a bad
and they
system.
make it so confusing and convoluted to
Yeah.
the point where you can't understand it. So you just put your trust in them to assume that they're doing the right thing for you.
Correct.
In your best interest.
Right.
And
And obviously that's
not the case.
at
Because they're
all.
just making money off you.
Well, you are a revenue stream. As much as bad as that sounds, its reality is that's what the patient is.
Yeah.
There's nothing more than a number and a source of income. And at the end of the day, what do you get for that? I think about what my health insurance costs me every pay, and let's just, I would say for most people, it's probably somewhere in the neighborhood of, if you had medical, dental, and vision, somewhere around, probably on the low end, $300 a month, maybe a little bit lower. And I'm talking, my situation is different than yours. Yours is single, but
Right. Yeah. Mine's a lot lower. But,
God forbid you have a family. If you have kids,
oh my gosh.
it used to be back when I first started in the working world and had health insurance, it was single plus one, which was like if you were married,
Right.
and then family. It didn't matter if you had one child or 4 kids. gotten a little bit better to say, it can be husband, wife, one child. But if you have, once you have 3 children, now it's a whole different rate.
Right.
You think about, let's just say $300 a month, $3,600 a year you're paying for that, in addition to all of these other things we're talking about.
And then you still have to pay all this extra money when you go do all these things.
Why do I pay insurance and still have to give the doctor $50 when I show
like
up?
I had a filling done. I was after my surgery and I had to go back to the dentist for a little filling. I was there for like 5 minutes. And they're like, "Oh, hey, you owe us I think it was like $85." And I was like, "Wait a second. I used the insurance the first time I was here. I paid you guys the last time I was here. Why do I owe you any more money?" And the same thing happened at the ER. I went back for a follow-up X-ray, and they're like, "Oh, you have a copay of this amount." And I'm like, "I just paid you guys." Like, I at this time I was like, "No, I can't." I was like, "I'm gonna probably ask for financial assistance." I'm like, "I'm waiting for my surgery bill to hit. I'll wait."
Yeah.
And they were like, "Okay."
And that's really the way you approach.
You have to be a little bit aggressive
because they will something
and they want you to pay it quick.
Well,
now
something that they're starting to do. I know this happened with my wife's mom, with my mother-in-law. She had a surgery, I think it was like a year ago. They wanted her to pay up front. Well, your portion of it's going to be X. They hadn't. That's from the hospital.
Yeah.
They hadn't even sent that claim to insurance. They're already trying to get money out of you. Part of that is because they're charging these exorbitant rates, and people are just not paying them.
Yeah, people are like, I
can't pay $12,000.
They did that to me the morning of my surgery.
They wanted you to pay.
They handed me a bill, and they're like, "Hey, by the way, this is what your surgery's going to cost. Did you want to pay that today?" And I'm like,
"Yeah, hold on a second. Let me give you $10,000.
Yeah, this is like over $10,000. My insurance hasn't even hit yet.
Right. That's one of the things they're starting to do,
messed up.
which is just
Do I look like I have $10,000?
Yeah, well, I mean, who does? Who's got?
Nobody does.
Hold on a second. Let me write you a check.
Yeah.
Here you go. Yeah, I'll just pay it off.
Yeah, no problem.
Yeah.
And that's another thing. Like, even though it sucks in the moment, it's like I'm starting to see that some people, like say you have to have something done, and you got a specialist that's like 10 minutes down the road from your house. They don't take insurance, but they can get you in tomorrow and you pay $250 done. Like, that's it. You go through your insurance and you got to go to Sarah out in Akron, but they can't get you for 6 weeks, and it's going to cost you this X amount afterward.
$750.
Yeah, like
I've seen
sometimes it's almost better to just eat the money up front, and it's not as much.
I have seen some things on social media, and I can't vouch for the validity of this when I talk about this, but it's an interesting concept. But where people are like going to an emergency room or like an urgent care or something, and then basically, even though they have insurance, they're saying that they don't.
Oh, okay.
Like, they just say, "I'm going to be a cash patient."
Okay, yeah.
It's cheaper. I can't vouch for
no, but I've heard that a lot.
Valid that is, or
yeah,
accurate that is.
Yeah.
But I've seen some of that stuff on social media, and I'm curious if that's accurate. I don't know.
Which, like, sometimes, I mean, like, I've noticed, like, some of the best care I've had is going through a chiropractor who is X amount each visit. And
not covered by insurance.
Right.
Which is insane. That's a whole other
thing.
Like, chiropractors have gotten a bad rap over the years.
I know.
The guy that we go to is a freaking wizard.
Yeah.
And he's trying to prevent you from having to have surgery or
he's trying to give you a permanent fix.
Right. And
long term.
And having conversations with you about nutrition.
Yes.
About exercise, stretching.
Knowledgeable advice.
Stuff that works.
Yeah, that's effective.
I have benefited from it.
Yeah, me too.
More than once, multiple times.
Yeah.
I've been seeing him for like 10 years now.
Yeah, I don't know. I've probably been seeing him like
everything
6
from
years or now,
allergies to, a little bit of knee pain.
He's helped me with kidney health.
Headaches. Migraines.
I had a doctor's appointment for just a checkup, just a standard checkup. And I sent him my blood work, and he was able to tell me more about myself than my doctor could, which is crazy.
Right.
Stuff
Right.
that I was being told the wrong thing by my physician, and they go back and forth at each other. It's like, because then the doctor's like, oh, don't listen to your chiropractor. He shouldn't be telling you to do that.
Yeah,
Yeah.
I don't know. It is such a messed up situation. I don't know what, and I just don't know how it ever gets fixed, because if you think about it, there are so many hands in that pot. And that, I mean, the healthcare industry is what, like the guy that we're referring to earlier mentioned this number. I think he said it was the health insurance industry, not health industry. Health insurance industry, $4 trillion business.
That sounds right. Yeah, because I mean, when you think about it, like even the whole story with like, I mean, look how much money like Purdue made, like, in
Yeah.
that whole thing
So
way back.
if you think about the amount of money that's involved, right? Nobody wants clipped out of that, right?
Right.
So, and we were supposed to have this law got passed about transparency, right? We were talking about that. Like, you're supposed to know what it costs to have procedure X done at this hospital before you do it, before you get it done.
Right.
You're supposed to know that. It doesn't happen.
No.
And then you get the bill, and then guess what? The insurance company said, we're only going to cover this.
Yeah.
Well, hold on a second. I thought if I met my out-of-pocket at my deductible, it was covered at 80%.
Yeah, and they're in control of all of that.
Right.
Like, they can rebate everything and tell you like how much this is going to cover, and that is how like the pharmacy benefit manager makes and that's why they're billion-dollar people.
Yeah.
Because they're like brokers. They're like making money. It's like when you
Yeah.
broker a load to a trucking company.
Right.
They're the ones making the money.
Mm-hmm.
The company's making a little bit, the driver's making the least amount, and then the broker takes all the money home.
Yeah. It's
insane.
a bad situation, and I don't know how it ever
And it
gets
doesn't
fixed.
seem like there's any movement on getting it fixed or
I don't-
changed.
I agree with you. I don't think there is, and there should be. It's criminal.
It is.
And and something that along the same line that we haven't even dove into is what happens with senior citizens. I've had experience with that with my parents, and they're on, the average American being on 4 prescription medications. Seniors are on more than that.
Yeah, probably double.
Yeah, and we got to give you this particular thing for this particular problem, and it's $1,000 a month.
Yeah.
Like, what?
I know. I saw some guy that had
It costs this pharmaceutical company like 12 cents to make that pill. How's it $1,000 a month?
like, why is this guy's MS treatment $14,000 a month?
Yeah.
Like, why is that a thing?
How is that even like?
and
Doesn't make sense
somehow
to
they
me.
still make the patient believe they're getting a discount or something.
Well, because they inflate the numbers. That's
Yeah.
that's what the pharmaceutical companies do.
Right.
They inflate the numbers and say, "Oh, this medication costs $600 a month," so the patient gets charged $700 a month. In reality, it only costs them $400 a month. So instead of making $100 a month, now they're making $300.
Yeah.
They just inflate all this stuff to make it, and then they present it to you, like you said, in a way that makes you think, "I don't know, 50% discount.
Yeah.
This is great."
Yeah.
And it's an area that the sad part of it is it's like, it's not like getting a car fixed, right? Where you
Right.
can go to your buddy who's a mechanic and he's going to be straight with you. Like, "Hey, this is my cost. This is what it costs for the parts. This is what I will charge you for labor. It's going to take me 3 hours to do it. Here's your bill."
Right.
And you can figure that out by yourself. You could go on Google and figure out what a set of brakes is going to cost from a parts standpoint, right? I don't know. I couldn't tell you at all what a pill costs. Like, how are you going to figure that out?
Yeah. I don't know. And that's the thing. Like, we overpay for almost every kind of prescription.
Yes.
It doesn't matter what it is. Even over the counter medicine too. It's like,
which is
it's absurd. Like, I don't remember what it was, but I bought I think it was around the wintertime. We had a cold and all that stuff, I bought some over the counter medicine, and it was like it was like $25 for pills that you can get
for like 10 pills.
Yeah.
Right. Yeah.
It's
Also have a bunch of shit in them that doesn't really work.
Yeah, it doesn't really work, and it doesn't really make you feel better either.
Right.
It just kind of like it
kind of
levels out the symptoms. For
dulls
a little
it
bit.
down a little bit
Yeah,
for you, and
softens
you feel
it,
like you're
so-
getting better. You're like, oh yeah, I
And
feel
then
better.
that 10-hour window's up, and then you feel like shit again.
Exactly. Yeah. Right. Right. Take every 4 hours. Yeah. You
Yeah.
have to, because 3 hours and 48 minutes, I feel like absolutely.
And then when
dog
you
shit.
get too far into it, where you're not getting a prescription, but you buy like over-the-counter drugs like an Advil cold and sinus
yeah.
that contains fentanyl, and then like some people can even get addicted to that, and it's
Yes.
like
Yes.
it's messed up.
Yeah. And you're right. I think that the crazy part is, I guess it's probably just because there aren't enough prominent names, because that's what it takes to get this kind of stuff done. For change to happen. You and I talking about it, nobody gives a shit.
Yeah, no,
But you got to have enough people talking about it that are prominent. A Joe Rogan or someone like
Right.
this, like that's really pounding on that drum
yeah.
for something to actually get fixed.
Yeah. I saw something. It was like they used Ohio as an example. It was like with this whole kind of scenario with like the people like people getting robbed with insurance and all that stuff. They
Yeah.
said that Ohio alone was like $250 million in fraud, something like that.
Through like insurance.
Yeah. And that's just like those people in the middle.
So I'm just trying to think through that in my head. What is that?
Like, where's that money going?
Well, and how is that happening? Is that a patient fraudulently doing something, or is it a
No,
doctor or an insurance company?
I think it has to do with the insurance companies
Okay.
and like the pharmacy benefit managers and stuff. Like all those people that decide how much something's worth and like what they're
what
going to
it's
make
going to
off
cost, what we're going to charge you for this.
Yeah.
And here's the other stupid part about it, right? When talking about pharmacies, would it matter what insurance you have through your work in terms that would change what that particular prescription costs?
of it. Yeah, I never understood that. Like,
That doesn't make sense to
what's
me.
the difference between
like your
insurance
insurance
companies?
Your insurance, you can get the prescription. It costs you $50 a month. My insurance, it might be $100 a month. Why? It's the same damn thing. It's the same pill
Yeah, I don't get it.
or the same prescription.
Yeah, I don't know. There was something I was going to say about that. I can't remember now. But yeah, I mean, none of it makes sense on like what you're paying. And like the thing is, they can I don't even know how to say it. The whole thing is so convoluted. It's
and
crazy.
that's intentional.
Yeah,
That's intentional.
right.
They want to. There's this web that has been woven to make it difficult to tie it back to any particular agency or person or company or whatever. That's on purpose. So you can't
So sad.
figure it out.
And that makes me wonder, like going forward, like because like soon enough, I'm not going to have insurance with me losing my job and all that. But it makes me wonder going forward. Should I get insurance? Like it just
Yeah, I mean,
it's kind of like one of those things. I'm not really too sure.
you can go out there on the what do they call it, the insurance marketplace,
Yeah.
through the federal government, which
Right. I don't know how much better that's going to be.
I have an opinion about that.
Yeah.
But at the same time, is it any worse than having it through your employer?
Probably not.
Probably not. It's probably not any different. I mean,
No.
of course, the cost
Still gonna
could
cost you money,
It's
but-
going to cost you money. It could the cost could somehow be different, but in terms of the level of care or what's covered or not covered, it's probably not a whole lot different at the end of the day. So it's still costing you money. It would be interesting to do the experiment to like go into an urgent care situation or ER and say, well, I don't have insurance, and just
Yeah.
see what that looks like at the end of the day.
Yeah, like in I think November is 6 months prior to my surgery, and I'm supposed to go to get a follow up, like get an X-ray so they can
Oh, there you
check,
go.
and
Oh, yeah.
that's a perfect opportunity.
Perfect opportunity to test
Yeah,
it out. See
I'll
what
test it
happens.
out.
Yeah.
and see what the difference is.
And this kind of goes, what I'm about to say goes back to something that we were talking about last week, which was sort of the established traditions of life, right? The things that we were expected to do. And that was always kind of the thing, was like, you just went to work and you got into health insurance and you didn't even really question
You
it.
didn't question any
You
of it.
just paid it. You
You just knew you had it, and it was
you
that
had
peace
it.
of mind, like, oh, at least I have insurance,
Yeah. Okay.
just like your car and everything else,
Yeah.
you don't think about it.
Right.
But now it's like,
At least the car insurance thing isn't as fucked up as
no,
this.
it's definitely not. Because at least there, it's like you're paying this amount of money every month, so that when something does happen, you have X amount they'll pay you to get your car
Right.
fixed.
Well, I mean, that happened with you. You hit that deer.
I hit a deer 2 years ago.
Yeah. And you essentially ended up with like half a new car.
Half a new car, and then I ended up getting a new car after that.
Yeah. I mean, you busted your hood, your radiator.
Yeah, it was all
jacked
almost
up.
totaled.
Right. You got all of that replaced.
Yeah, and it was a pretty, and they got me a rental car and everything. I mean, it was no.
And it costs what, $250 or whatever
something like
the
that.
deductible was?
Yeah.
Right. I guess in my head, that's how insurance should work.
That's how medical insurance should work, right?
Any insurance should work that way. I'm paying into this pot, right? I'm paying because at the end of the day, what comes out of your paycheck is going to the insurance company. So, my portion's $300. Let's say the company's portion's $700. Let's just say for easy math, it's $1,000, which is probably nowhere. It's probably higher than that. But for simple math, $1,000 a month is what it costs to have me on insurance. And you have a company that has 2,000 employees. Do the math. That money is going right to the insurance company to do supposed to be doing nothing but paying claims, right?
Right.
Isn't that the idea? You're building up a pot of money that when Fred's claim comes in for his shoulder surgery, you look at it and you say, okay, he met his deductible already, so we covered 80%. It was a $10,000 surgery. We cover 8. His portion's 2.
Right.
Okay. Pretty easy.
Yeah. Yeah. It's crazy.
Why does it not work that way? Why is it? Why? Because we're talking about just a huge amount of money.
Yeah, and like
a lot of people in on it.
A lot of people, like I've had coworkers that are like, man, our insurance sucks. Man, they didn't even
Yeah.
cover this and that. And I'm like,
Yeah.
do you not understand that the insurance companies are in control of what our company covers for us? Mm-hmm. They don't get to decide that. They just picked the best option. And that's why year and then they give you that option to sign up for specific plans, like the gold plan that gives you all this extra shit. And it's like, but really it's not.
At the end of the day, it's really not
really
a
not,
bunch of
though.
extra shit.
They're just
It's
giving
extra
the
money out of
company
your
that
pocket.
so that you can be like, hey, we do offer all these options at
Yeah.
your own preference
Yeah, and at your expense too.
and your expense.
Right.
Yeah, it's so crazy.
Yeah, it's a bad situation, and
And this is the kind of stuff they don't prepare you for. Like as
school?
a kid into young adulthood,
No.
you don't learn
No.
about any of this shit, and they should be teaching this.
well, they
stuff.
can't teach you
Well, yeah, they can't because then they'd be
because we don't understand it as
shooting
adults.
themselves in the foot.
Can you imagine 14-year-old yourself trying to understand this stuff?
No, I'd
Right.
fail.
So it's, and again, I think that's all by design. I think that's the way
No, it
it's supposed
is.
to be. I hate to say that, but I think it's all. And I tend to be as I've as I've gotten older, I tend to be very suspicious of
Oh, I question everything.
this kind of stuff. I look at it and I go, "This is a fucking."
I used to always
scam.
just kind of go with the flow, just
Me
assume,
too. Me too.
I never really gave a shit. And now I question every little thing, and I'm like,
I look at this stuff,
isn't right.
and then when you hear, oh, well, the federal government's involved, and I go, okay, well, now it's definitely fucked up.
yeah. And it's like they keep us sick so we can feel better, so we can continue to work, and then it's just
But you're just sick. You're just sick enough. You're just sick enough that we need to have you on this medication for the rest of your life.
right. They're not going to try to find the solution to make you feel better, even if they do know how to cure the disease or whatever it is.
We have your blood pressure under control. Bad news, you got to take it till the
Yeah.
day you die. Wait a minute. Why? How? What? Because if you stop taking it,
I got a deep off the wall question.
okay.
Do you think, because this is just as controversial as the moon landing,
Oh.
if it was real or not, but this has nothing to do with the moon.
Okay.
Do you think that they have the cure for cancer somewhere or any other kind of disease that's out there? Like, just in your opinion. Like,
I'm going to say yes.
I think so too.
And it's funny you bring this up because these are those things that make you go, You think about these organizations, these nonprofit organizations that are set up to raise money, right? The American Cancer Society, the American Lung Association, right? The whatever, right? They get you to donate. Oh, hey, call in and or text, Red Cross. Text this number for $10 to go to. In my lifetime, I would love to know, and I'm sure we could find it. We don't have our phones with us. We could find out how much money the American Cancer Society has raised
Right.
over the last, let's just say the last 50 years. And I know there are going to be people who go, they're doing research.
Yeah.
Okay. Don't you understand all the advancements we've made when it comes to cancer? I do.
Yes.
I do. I get it. But the advancements that we have made are supposedly towards treatments.
Right. Not cures.
Which at the end of the day, we're going to talk about cancer. You're basically just poisoning a person the last however many years of their life that they're going to live
Right.
with cancer. We're giving you chemotherapy. It's a poison.
Yeah.
Radiation, a
Making
poison.
you sick.
We're killing these cancer cells, making you sick, we both saw a very good friend of ours go through that process who passed away 3 years ago and saw that decline and what happened in about 10-month period
Right.
from all of that. And then, well, we didn't get it all, so we're going to have to go do it again.
Yeah.
And so you go through it again to do what? You die anyway.
My opinion on that topic is like, if that is the case, like if you're at that stage and like this is what you have, and
I'm not doing that.
I would rather live out whatever time I have left.
Me too.
Doing everything I want to do with who I want to.
Me too.
Versus trying to push my body through the hardest part of the whole thing and being just sick and miserable and helpless the whole time.
Me too.
To maybe not make it,
And, well, you probably aren't.
You probably aren't.
You probably aren't. Most likely you're not. So if you're going to be sick and miserable, just be sick and miserable from the cancer.
Yeah.
Is it going to be any worse than
Yeah. Is it really going to be that much
throwing
worse?
up 16 times a day because of radiation that you've had every day for the last 8 weeks? Is it going to be any worse than that? I argue to say it probably wouldn't be.
It's just like my whole thing. Like, it's so funny after I've talked to so many doctors in the last couple months and multiple surgeons, urologists, all this stuff. And it is incredible to me that even though all the knowledge that we have on what causes kidney stones, they still really don't know what causes them. Like they know things that like can
Lead to
it or make them worse. But ultimately at the end of the day, they cannot give you a straight answer on what actually causes them and how to prevent them completely.
Yeah.
They don't. And they're like, because this is in quote unquote, he said, if we knew, people wouldn't get them.
If we knew, people wouldn't need us.
Yeah, right. It's insane. And then like as a person, you got to then try and take that road after you've been through something like that and, live a healthier life,
And
make good choices. And it's like,
and will that really help? Like, okay, so
especially now that like I'm prone to it, like will it really help?
And that's another interesting topic is like, I've had one in my entire life.
Okay.
Awful experience,
Terrible.
as you know. But you've had
Multiple.
multiple. So it's kind of interesting to think what's different about our biology that leads you to be more prone to them than I am.
I had a conversation with a person at work yesterday about this, and he was like, "Yeah, he's a driver," and he's like, "Yeah, in the summertime I drink like a whole case of Gatorade, and I drink like a bunch of Mountain Dew, and I drink a bunch of Monster and all this stuff," and I'm like,
great.
and like he's not in good shape or anything, and he's like, "Yeah, my girlfriend was like, I'm surprised you've never had a kidney stone." I'm like, dude, I would instantly form a kidney stone if I drank like you did.
Yeah.
Like, that's insane. He's like, yeah, I've never had one.
Wow.
It's incredible. And that's another thing I want to understand. Like, I almost want to like do some kind of study and understand it more into why some people get it more than others. Like, what is the real reason?
Well, it has to be. I'm not a doctor. You probably knew that. And I mean, I've done a lot of research on it, and I myself have had personal experience with how the liver affects everything. Mm-hmm. And that was a big issue for me with my allergy situation I had, 8 years ago, whatever it was. But like, so it's obviously, I think it's probably related to that, how the liver is processing or the removal of certain toxins and what have you.
Yeah, the way they explained mine was like it's the buildup of calcium and oxalate forming together in the kidneys. So there's like a lot of high oxalate foods.
Okay.
And what's crazy is most of our healthy foods are high oxalate.
Okay.
Which is crazy to think about. And when I was done, my urologist gave me a sheet and he said, "You don't have to follow this religiously, but this is a guide to what to avoid mostly and what you can have most of." So, kind of like a in moderation kind of thing, like, you know, don't eat a ton of spinach, don't do this, don't do that. Spinach is like one of the highest
Is
ones.
that right?
And almonds.
Huh.
Yeah.
Both of those foods are highly touted as healthy for you.
Yeah.
I mean,
Like, think about a vegetarian.
almonds are something that are great for magnesium, which is really important to your body.
And what's crazy is I was told that I needed more calcium and magnesium in my diet. So I was taking vitamins for that.
Yeah.
And I still don't know if that was causing help,
So you're
like
getting like too much
too
calcium.
much calcium. And I kind of laid off of those because I don't drink a ton of milk and I don't eat a lot of cheese, but I do consume it regularly, you know?
Maybe? Yeah, yeah.
So the main thing, and this is about the takeaway I got from it, because I don't want to be some crazy food Nazi and like be all like, I have to have
can't
this
eat
much of
that.
this every day. And like high animal protein supposedly is really bad, which I don't totally believe
And
that.
I don't know that I believe that
because
either.
I think we were born to eat meat, you know,
I
like,
think there's a lot of evidence out there from stuff that I have looked at that says the absolute opposite of that.
right. I know.
The
And I eat
100%
everything.
opposite of that.
I mean, every week I eat every type of protein, basically.
Yeah.
And the
So
biggest
they're
takeaway.
saying, so he's saying that that's not good for the like the oxalates.
That's what they're saying. But
Interesting.
the biggest thing, and I've already noticed a big change, is he's like, the biggest advice I can give you is just drink more water.
Yeah,
Water
I think-
is the most important thing
I
that you
think
can
that's
consume.
huge. So something that I'm going to start doing is, so you had a hydrogenated
Oh,
water
bottle?
bottle.
Yeah, it was pretty
So-
cool. I broke it.
but and I drink a ton of water. I probably drink a gallon a day.
I'm about where you're at now.
I
That's
probably
how
easily
much I
drink a
drink.
gallon a day. But something I'm going to start doing in my first thing in the morning, because I've changed that routine. You and I talked about the caffeine and stuff. I pushed that off an hour. I used to
Right.
drink coffee like immediately.
Yeah, I don't do that anymore.
Now I wait an hour to an hour and a half after I get up. But I'm going to start using a pinch of Baja Gold salt in like 16 ounces of water to drink that first thing in the morning.
Oh, really?
Yeah, so it's a sea salt, but it's non-refined. So it has all of the minerals that you need, but you only have to use like a pinch.
Yeah.
And it's supposed to help with
Just
brain
like regular
function.
water?
Yeah, just right. Yeah, I use filtered tap water.
Okay.
Which is way better than bottled water.
Is it really?
Yeah, bottled water. Well, because of the plastics.
Oh, yeah, and I guess, I mean, they do put minerals and stuff in it to make it taste better.
Yeah,
and all that
but
stuff.
the plastics in it are what's the problem.
Yeah, I never thought about that.
So they say that just filtered tap water is the better way to go. If you don't have
Yeah.
access to like
I-
spring water.
What's
or,
crazy
you
is
know,
I did have I had a filtered tap until they changed our faucet at our place, so now it doesn't fit because
Oh.
of the curve of the faucets. Now I have to.
Oh, okay.
They don't even sell an attachment for that.
heck,
curve,
even if
so-
you got one of those like those little Brita filter
I have one of
thingies
those,
like
too.
that. I mean,
Yeah.
that's just as good. It just filters some of that extra garbage out of there. But yeah, just that in the filtered tap water. It's supposed to help with brain function, and it supposedly helps your body hydrate better. Like,
I guess that makes sense.
and that's also the science behind the hydrogenated water.
Oh,
It
okay.
supposedly helps your body absorb the hydration that it needs, as opposed to just
Yeah.
running it through your system and then peeing it
Because it's
out.
adding like however much hydrogen. Because there's one hydrogen and 2 oxygen
Yes,
in water.
in regular water, right?
But then
it
the
adds-
hydrogen bottle's adding more hydrogen to that. Yeah.
right?
And that was the way I was explained to how it works, and that's
Same.
yeah.
Me too.
So, and I want to get another one. I think I just didn't buy the best one.
Yeah, I've looked at them too, and they're all over the map, like what you can pay
Yeah.
for them, and it's like
You can go pay from like $20 to like $60 for a bottle
or more.
or more.
I've
if
seen
you
them
get-
for more, but I can buy a pound of this Baja Gold salt for $20, and I'm using a pinch a day. It's going to last me forever.
I was told to do either, and I do have some at home, and I was told they also have like a gummy or a vitamin, but taking apple cider vinegar in the morning. I don't know
Yeah.
if that's beneficial.
I've heard. I don't know enough about it to speak
multiple
intelligently
people have
about
told
it.
me it just is good for you, and it
Yeah.
actually prevents you from getting sick.
Right. It is supposed to be. I do know that it is supposed to be a immune system builder. Yeah.
Crazy.
Right.
But the pharmaceutical companies aren't going to tell you that.
Well, why would they? Because they don't make any money.
They don't
off
make
of
any
that.
money doing that.
Right. The moment that you need a prescription for it is the moment that you need to be aware that it might not be the best thing for you.
Right. Crazy stuff.
That's the sad part. God forbid that you could go to Amazon and buy something without them getting their cut.
That might actually
That might-
benefit you.
That might help you. That's where
So
we draw the
crazy.
line.
Crazy.
I don't want to sound like a crazy conspiracy theorist, but I think if do your own research, look it up, listen to some podcasts, listen to some of these people that Sean Ryan or Joe Rogan has had on.
There's plenty of them out there.
Dr. Casey Means is another person that will talk a lot about the medical industry and I guess in this day and age that to me, I think you're not doing yourself justice if you do not do your own research. Whether it's, at the end of the day, whatever you think is best for you is the way to go.
Absolutely.
But I think you owe it to yourself to do the research. Even if it's, and I'm not a big doctor person. I've never had a surgery other than had my tonsils removed. And that would be especially like when I was having some back issues and hip issues, that was like the last thing that I would ever have wanted to do because I've heard the horror stories. I know people, a guy I work with had 2 back surgeries and the poor guy can freaking barely walk.
That's terrible.
And I found this chiropractor who turned that all around for me. So, but again, I think the big takeaway is do your research, look it up. Don't just go to one source. There's a million places out there you can find information about this stuff we're talking about.
Yeah, and don't put all your trust in these companies. It's scary.
No, you can't.
Yeah.
No, you absolutely cannot do that because at the end of the day, there are corporations that have shareholders. I mean, let's talk, we can dive into for a second the whole opioid issue and the whole Purdue
Yeah, I was going to bring that up. That's
oxycodone thing. I mean, I'm sure a lot of people watching this have seen some of the documentaries that are out there. Painkiller was one.
yeah. Actually, I learned more about this just by watching the Hulu series Dope Sick
Dope Sick and
with Michael Keaton.
Michael Keaton and Painkiller with Taylor Kitsch is on Netflix,
Yeah.
which is also the same
kind of
story.
thing.
And you'll see what it's just a snapshot. And I'm not saying that every pharmaceutical company is a bad actor, okay? But just you'll see the millions and millions and millions of dollars that they poured into marketing this product as a pain management solution that just went awry.
And it's so sad to see that they even tricked the physicians into it.
Yeah.
Like made them believe it.
Yes.
And made because
Well,
they
and they
sold
were-
it to them.
Well, and they were
to sell to their
and-
patients.
and you've seen that you saw that, and if you should watch Painkiller because that shows a little bit more of how the sales side of it worked. They're whining and dining these doctors and giving them vacations for take your wife to Cabo or whatever all of these incredibly expensive perks to push the drug, and we all know that we know how it's ended up and we know where we are today when it comes to that, and it's sad. And I do understand, I myself don't have personal experience with this, but I do understand that there are a lot of people out there that deal with pain on a daily basis that have chronic pain, and it's debilitating for them. I understand that.
The biggest part of it is that the system is failing them
Right.
at getting them better.
Right.
And that's why they're in that situation.
Right. It's too bad. And I don't know. I just hope that more people speak out about this and talk about it, and maybe and the crazy part is that it's so, like you said, convoluted. There's so many layers to it. There's so many people involved. There's so much money involved that fixing it or better regulating it is going to be really challenging.
Yeah. Yeah. And unfortunately, most of the time in these situations, people are desperate and
Yes.
need help
Yes.
in those situations. So they're just
Yes.
they're ready for the quickest fix and the best solution to get past whatever they're going through
Yeah,
in that time.
you know, in those shows, you know, you have people that do, you know, doing like physical labor jobs that literally can't get out of bed in the morning to go to work, and they have to go to work because if they don't go to work, they don't get a check.
Right.
They got to, like you said, they need something that's going to offer them a quick solution that I can pop this pill, I can get my ass out of bed and go to work
Yeah.
because I got to get paid.
Crazy.
Yeah, it is crazy. So
And I'm sure we can cover more of this in another episode.
Absolutely,
I
yeah.
think there's a whole other layer to this that we can touch on.
yeah, I will.
I'll do a little more research.
I'm going to do some more research too.
Yeah.
We will be back to you with the guy's name that we've referred to a couple of
Yes.
times. I cannot.
that we can't think of.
I can't think of his name, but we will have it for you.
Yeah, and if you guys like this episode, leave us a like, follow us on Spotify, Apple Podcasts, and YouTube, and we will see you next time.
See ya.